So in response to the HHS releasing a report entitled Wolves in White Coats about the fraud of gender medicine, a ton of people online are claiming that this doesn't actually exist. And I'm here to tell you that it does exist. It's been happening here in San Diego for over a decade. And these doctors and institutions, they operate in secrecy. So if you think you can do a quick little Google search and find what they've been doing, you're wrong. Last January, my friend Britt and I went to UCSD's Transgender Symposium. We heard for ourselves what the doctors have been doing and how the model of care is shifting towards all patient-led and patient-driven. So I want to read you a few quotes so you understand this is real, and I want to drive you to read my article, my eyewitness account of UCSD's Transgender Symposium. It's all activism and zero actual science. Former Rady children's nurse who cared for young girls after mastectomies told me about her experience inside the hospital. When I asked how young the patients were, she answered, "I can confirm they do surgeries, and I personally cared for post-operative adolescents. I can confirm they do hormonal implants and mastectomies." She went on to say, "I saw children as young as 5 whose parents were attempting to affirm gender based on their personal beliefs." Another doctor who fled Texas after her gender clinic was shut down, her name is Ximena Lopez, and she said that she would repurpose federal funds to preserve gender-affirming care if their own funding got cut. Then we have the issue of trans family support services, goes into the public school system, rolls out the red carpet for these kids, and basically recruits them to end up at Rady Children's Hospital. After showing us these really graphic images of post-op surgeries, Dr. Cecile Ferrando said they are no longer binary anymore, that patients come in wanting variation, so we do whatever they want. Also sitting in the room listening to this presentation was Dr. Maha Marinkovic, and she is the head of the gender clinic. And what concerns me is she's listening to these surgeons about how there are no longer really any guidelines to this medical care. I can't help but wonder, is this the future of this gender affirming care for children? There are no guardrails. Another troubling thing that I heard was the analogy that the program director of Rady Children's Hospital's gender clinic, her name is Bixby Marino Kibbe, she compared their methods of care to a school bus. She said, individuals, regardless of age, are the experts on themselves. And as providers, we must recognize that we do not know better than our patients. What?